Umintri bedaikmi ya karnar ka kwet ka kya ka sorkar jlau James Piki Sangma mandaga sngiu la lej hakaban pli ya ka biological waste management system ka geriatric ward ka badon spotli jingthia rangkat ka PSC oxygen generation plan ha civil hospital Shillong haga jingelang blapelong kerpang haga jingelang ka blapelong ha kerpong jongnik hospital bat blapelong ya ka office jong joint director of health services civil hospital Shillong habakran haga jingelang James umla pan klem de portu pat yero ya ka jinglen la de pat IT med bat mensim kinong tray ki bakan thup na do ki medical but ki non medical staff ka civil hospital Shillong kham tam lele haga bay day pat korukom ban penyat bed penyat rinti ya kani ka jaka ai jing sumar branam jong jylla ha korukom ka bedai day na mar ka jingnang bat tibet hakliang ban penyat bakla plong ya ka civil hospital Shillong gom ka way ni ki jaka ai jing sumar ka bapakatam ka baki way ki hospital sorkar ki badon hak district ken ha panchim ne ban but ya ki nuksa trekam ki jongka habai day pagjing play pait ba yakini ki light li jingte hagni ki jaka ai jing sumar ujem sulong magani ka kren bat bani shai kadar ya kata ka jingya linti ka jylla hagathong bat usngo sorong ru bat lengba ka jingwan ban play ka jing u yakini ki light li jingte kan day biang ka dak jong jingsdang bat ula banjur halok jing don kam ban but iki nuksa habaro ki jaka ai jing sumar sorkar ki badon hagajla bala saki lang ya ka jingelang kenthop yu sapat kumar principal secretary health and family welfare department ubala wan chakmat ban pertu ya ki nongtre jong ka hospital ke bala tre sitom hagapor ka jingwan ban link shop jong ka klam jingpang covid-19.
I would like to thank Almighty God for this beautiful day and for always blessing our state with so much of His grace and everything that we can ask for. I completely agree with what our Principal Secretary just mentioned about the kind of services that Civil Hospital is offering, the kind of achievements you've been able to achieve over the years, and this is really something that all of us in the health department, especially me, we are very, very proud of, and really I would like to start off by saying that we really appreciate the kind of way that things are systematically organized here, the way that the doctors, the nurses, all the non-medical staff, everybody in Shillong Civil Hospital, kind of services they offer. It's not easy. I know how difficult it must be. Being a doctor, being in the medical profession is one of the most stressful jobs. But yet, all of you are offering this yeoman's service, which is really very commendable. And thank you to each and every one of you, and congratulations for the kind of achievements that you've been able to achieve. Progress is always measured, always when we think of progress, it's in terms of economics, how we as a state are progressing by our GDP or GSDP, or how we are economically progressing. But real progress actually lies in very, very small things, like how we take care of our children, how we take care of other neglected sections of our society like the elderly. And today, when we speak about the success of Shillong Civil Hospital, today you are setting such high standards and setting benchmarks, which is going to be very, very challenging for other district hospitals to follow. But these are standards very much required, and this is how we gauge and we measure our progress in our state. This is something that I'm extremely proud of, and today we are not inaugurating just one but 3 such interventions. COVID has been a rude awakening for everyone, but nonetheless an awakening, and it has made us sit up and look at very, very small things which we would have on our day-to-day lives missed out, like the PSA oxygen plant. And I'm happy that today Meghalaya as a state is extremely self-sufficient when it comes to oxygen supply in our medical facilities. And this plant is being inaugurated. It's just a formality. It has started functioning a long time back, and it has been functioning very successfully. And kudos to the medical staff, the surgeon superintendent of the hospital, along with all the other supporting doctors and the staff, for successfully implementing this and making sure that it runs in a proper manner. And I'm also would like to congratulate the entire team for the geriatric ward and the waste management. I can see Bardon, who's here, who's responsible for bringing this here. And waste management, as Mr. Sampath was talking about, decluttering, right? Cluttering is always something that brings about negative energy into the place. And negative energy in a place like a hospital is one of the most worst things that can happen. So I am so happy that it's not just about decluttering, but also a very, very integral part of any good hospital and its functioning is how we manage waste, which is very often biohazardous. And by having a state-of-the-art waste management system, I'm very sure that we will be seeing immense leaps and strides and improvement in our sanitation and in our waste management by way of waste management. So these three interventions which are being inaugurated today, these are very, very I think important, have been long overdue, but I'm happy that it has started today.
Civil hospital has done extremely well during the COVID period. In fact, you have proven how actually a public sector hospital can do differently. This is something, I'm not saying that just for the sake of saying I have the data. We used to see how many patients were treated at civil hospital and different hospitals, how many have been actually, have recovered and, done very well. Extremely remarkable work is done by the civil hospital. I must congratulate, and this is the strength. I think this kind of a spirit we should continue. In fact, yesterday I had received one message from one district level medical officer. She sent a message saying that we were quite involved and motivated by the rescue mission. Every week we have this in-depth review that happens. So they are taking so many actions. Things are happening. We are and she's also giving us suggestions that on the World Environment Day is coming up, we heard a World Environment Week is going to be launched, in fact, by our honorable health minister, who is also forest and environment minister. So what they said is that can we actually remove all the junk in the hospitals? It's a very good thing. We should remove, if we are issuing those instructions, remove every junk. We should make things, hospitals more clean, and we should not keep something which actually, some instruments are not working for years and years, but we keep them there, and vehicles we keep them there. So it's a very important thing. So that spirit I shared with one policy person, who is actually helping us in terms of getting best insights from at a national level and international level. They also have come here as one Professor Sundar Raman. He was the executive director of National Health Systems Resource Center. So for 7 years, and is a great person. So when he was, when we shared with the team, they said this contagious spirit is the key thing for any change in the state. So we need to have that positive spirit which is contagious from one doctor to another, one nurse to another, one healthcare worker to another. I think this is what we expect. We need that spirit. I'm sure, like, we have a good team. I'm seeing one Dr. Anisha sitting just like that, and she has taken so much motivation, very enthusiastic, and now today you see that cancer hospital is running, and it is running so well, and we are going to have the best care services offered by the civil hospital, all the super specialities, and it can become like a Nizam Institute of Medical Sciences, or like for Telangana there is a state like that, like for here we can have a civil hospital in Shillong. In the days to come, we should have envision that it will become like that kind of a state level Institute of Medical Sciences. So